Attention, attention. All units report to your favorite podcast stat. This is That's So RN, where we decode the chaos, call out the cracks, and care a little louder. Let's scrub in.
Oh my goodness.
Hi guys. Welcome back to another episode of That's So RN. We are now in season 2. Woo woo. This season is called Educated or Indoctrinated, and it is based on nursing school, post-nursing school, pre-nursing school, things maybe people had to do to get into nursing school, some of the things that I went through in nursing school, and some issues that I just want to talk about. I was supposed to post an episode last week, but I've just been really busy and really tired and trying to make time for this. I don't like starting projects and giving up on them. So one of my goals for this year was to start a podcast and just get my story out there. And I want to see it through to the end. But I will say I do not see how people go and do like day in the life of and record all day. It was so hard for me to come and be able to just get time to sit and make myself look like somebody and not a zombie with everything that I've been doing and get this done. So I'm really excited. Today we'll be talking about nursing school, my nursing school experience, some of the things I went through and dealt with in nursing school, and just a plethora of other things. So firstly, I am a registered nurse. I do have a doctorate degree in healthcare admin. I got my license for my LPN, well, my degree rather, for my LPN at a school called SLCC, that is South Louisiana Community College. Whoop whoop. When I went to school for RN, I went in Arkansas, a little town called El Dorado. It was a consortium, so they had several schools. I went to South Ark Community College for my RN. I got my bachelor's and my master's at Capella through their Flex Path programs. And for my doctorate, I got my doctorate at Virginia University of Lynchburg, and that was in healthcare admin. So I didn't go the NP route just because I didn't want to do all the extra practicums and stuff, which we had clinical and practicum for that program. It just kind of entailed a little bit different things. For me, I loved my LPN nursing school experience. Absolutely loved it. I would do it again 100 times over. I think that was one of the best experiences I could have had. And just with those people, it was really a right place, right time thing. I had just moved here and was trying to get on my feet and really try to figure out what I wanted to do with my life. And those people just, I mean, anybody who's been through nursing school, it's good to have those friends after nursing school, but y'all are like trauma bonded. Y'all are trauma bonded together because y'all are just dealing with all the things together at the same time. My RN experience, I did not like it that much. I wish I could have took my nursing friends that I made and had in LPN school with me to the RN program. On top of me traveling 4 hours one way, 3 days a week, because that was the only program close enough that wouldn't make me wait 2 years to start. It was just a lot of drama, a lot of BS, a lot of favorites and pick-me's and all the things. And my patience was thin and short, and I was ready to act the fool there more times than not. I was so ready to get that over with. Baby, I had never burned rubber so fast out of a place. So for my bachelor's and my master's, like I said, I went to Capella. I did the Flex Path program for each. With my bachelor's, I did the advanced master's pathway because I knew I wanted to go back for my master's and use Capella again. So with that, they took away a few of my bachelor's classes and replaced them with master's classes. So that way I would have to do less master's classes when I actually got into the master's program. So that was kind of neat. And then for my doctorate, I was like, man, at this point, I don't want to go the NP route. I want to be a CEO, a CNO. I want a business degree that is solely focused in healthcare, various healthcare organizations, how to manage them, how to run them, and how to keep them successful and, constantly multiplying and surplusing. So that's some of my stuff. So let's get into it. That was just a little intro, but let's get into it. So nursing school. One of the things I absolutely hated about nursing school was the toxic, tough it out culture. People are going to tell you nursing school is hard, which it's not a lie. Nursing school is very hard. Nursing school is a lot. It will cause a strain in a number of ways, whether that be emotionally, financially, all of that. I feel like a lot of the times we are not creating a supportive environment for those people. I feel like sometimes it's really just us saying you got to deal with it because this is just what it is and this is how it's always been. You got to stick it out if you want to do it. We will see, if it makes or breaks you, and we will see how bad you want it by how you react to all the things that you kind of have to deal with and go through in nursing school. A saying I absolutely hate and do not agree with, and I don't like to use the word hate, so excuse me. A saying I absolutely dislike and don't agree with, saying if you can't survive nursing school, then you can't survive on the floor. There are so many more things in research and resources allotted to you once you graduate nursing school. I mean, a lot of the time, I feel like nursing school kind of just is there to help you pass NCLEX. And I will be quite honest, in some of my programs, most specifically my RN program, I was teaching myself. So I can't even say it was there to pass. You really don't learn how to be a nurse until you're out of nursing school and you're on the floor, seeing everything, how it runs, and kind of putting the pieces together. I am very type B. I have ADHD. I just really cannot sit for a long time. So like study methods and things of that nature, it just didn't work well with me in a classroom setting. I would rather listen to an audiobook while I'm driving or while I'm working out or see visuals or pictures, things like that. So that was that was very hard for me. But yeah, so I used that way to learn. But when I got on the floor, I was just like, we did all that. I could tell you now, baby. Miss Scholes, if you're watching this, she was my favorite instructor in LPN school. Baby, she drilled them lab values into us. I literally was telling everybody what potassium was, 3.5 to 5. You couldn't tell me nothing. Baby, I knew all my lab values. I knew everything. So, but I don't feel like you need to know all those things I feel like it's just to get you through. Like nursing school is just to get you through. But like I said, even sometimes once you get through, you're still on your own with studying because you'll learn everything once you get to the floor. So I digress. Constructive criticism. Not all my instructors, but there were times when I felt like some of my instructors were just telling me stuff to kind of get in my head and play on how I felt and how hard everything was and how stressed I was. I laugh now because I didn't really think about it then. Before it's just like, oh, you're telling me this, like I have to listen to you, your way is law. But then as I progressed and got through my, nursing career and started learning and doing more and going back to school, I'm like, this is not necessary. This is not necessary, and this is not constructive criticism. You're trying to break me down, and we ain't going for that. So nextly, I would like to talk about gatekeeping in education. I'm sorry, I kind of digressed earlier, but gatekeeping in education. So instructors making things unintentionally hard. We just talked about that. Just because they went through something or they went to school and had to deal with a certain thing, they feel like, oh, well, I'm going to get my payback with these innocent students coming in here, and I'm going to make things 20 times as hard as it was for me because that's what I had to deal with. And I just don't agree with that method. The next point was like old school versus new school with teaching. So I started teaching last summer in a nursing program. I particularly focus on their practicum, so their clinical, because I couldn't do classroom with my full-time job. But even with that teaching, it's so funny to see. I feel like I was raised by what you would call old school teachers. And I love that way, but just in today's time with advancements in technology and things constantly changing, I feel like it's good that we're starting to kind of steer away from that. I find more now that we are having instructors that are, my age or younger, or maybe a little bit older, but not quite as old, starting to teach. And I feel like it makes us more relatable. Sometimes it could pose a problem, especially for me when I was teaching. I had a few students that were older, some that were my age, and then some that were younger. But they would always be like, oh, do I have to call you Miss Smith, or do I have to call you Dr. Smith or Professor Smith? So in that aspect, it did cause some of us to butt heads or cause some type of friction or conflict. But overall, I think it was a good experience just because we bring kind of a breath of fresh air, a freshness to teaching and letting them know that, somebody my age with this background or this knowledge can teach you just the same and better understanding, more relatable, just because we're a little bit fresher and newer and just more adept with the changes that were most recently made. So next, teaching compliance versus competence. I think that is so important that we're not just teaching these students to just do it and not know how to do it, how it works, why it's being done, not all those little small details that matter. I will never forget when I got on the floor as a RN after I got my bachelor's. Just the shift in a couple of years from us going and doing skills, knowing how to do it, why it's done, or already having in our mind, oh, well, this is going on with their labs. They're probably going to have to do X, Y, Z. To, oh, well, I'm just going to go on the computer and check that I did this, check that I did that. Compliance is such a big thing now. And I said this before on previous episodes. It is really taken away from, your critical thinking that you are having as a nurse. So I definitely feel like now, instead of teaching a nurse or a new grad to be competent in a skill, they just want to make sure they're complying with whatever their organization or whatever, the board of nursing or whoever says that they need to do. And that doesn't really make for an effective nurse. I remember one time I had transitioned from my full-time floor job to my wound care job, and we went to see a patient. I did her wound care, dressed her, cleaned her, all that. And they're like, we really need a Foley on this woman. Now me, I feel like I'm always looking for a chance to do my skills, and I make sure that I keep up to date on my skills. So two people had tried to get a Foley. She was like, I'm going to give you one time, and after that, I just won't have the Foley. So I get all my stuff out. I take out my phone. I wash my hands. I get my sterile gloves, and I do this whole sterile procedure over. Well, I get the Foley on the first try, which I knew I would, because I was like, Mama still got it. But just being, competent enough to know that I've been practicing these skills. We have mannequins and things that we use, and I make sure I'm up to date. And everybody was shocked, and I'm like, well, yes, I'm doing wound care, but I was like, at the end of the day, I'm a med surg and telemetry nurse at heart. That's where I started. That's what I got my feet wet in. And those skills aren't just going to disappear after a few months of me not doing it. So what are some of the mental health costs of becoming a nurse? I'm sure if you talk to a number of nursing students, they will tell you they're on, anxiety meds, they're on depression meds, just all kinds of things. So my family, I found out more recently, just already has mental health background and extensive mental health background. So anxiety, depression, bipolar disorder. And I feel like maybe that was underlying with me, but I didn't know it in nursing school. Definitely exacerbated that. They exacerbated my anxiety. I had to start taking medicine. They exacerbated my depression, and just made me feel like, okay, this is something that I really want to do, but am I willing to go through X, Y, and Z to get it done? And it's so sad because it really is true. get burnout before you even get your license and hit the floor. You get burnout during school and you just are pushed, past all of your limits, and you're pushed beyond the things you think you can do. And you get to a place where you're like, do I have any more to give? You do. You do have more to give. But it just becomes a lot after a while. And it's to a point where it's just like, we're having breakdowns. We're having breakdowns and we're not telling nobody about it, because going back to one of those first things we talked about, we're pushing that tough it out culture. This just comes with it. And this is just what I have to do to get through and get everything done. When you don't have to compromise, there's workarounds or things you can do to kind of alleviate some of those symptoms. I done cried in the car. I done cried in the break room at work. I done cried waking up to get up for clinical in the morning. I done had breakdowns and just really, again, constantly second guessing myself. Even after I graduated, I had imposter syndrome so bad. And I think a lot of people do, just because of what you have to go through to get to the end. And you're just like, not putting yourself in the headspace of, oh, I deserve to be here because I worked hard for it. It's more like, okay, I'm done. Like, what's next? It's just another task checked off my list. But I don't like that, because we should be celebrating all of our wins, no matter how big or small. We all worked really hard to get where we are, and that should be celebrated. Ain't no imposters around here. Boo. Meds, therapy, stigmas among people with help. Y'all, I am such a big advocate, and I'll talk about this a little bit later in the series or my seasons. Mental health. If y'all need help or you feel like you need help, please do not feel embarrassed or feel like you don't need to tell anybody or feel like you just have to deal with it and you're able to manage it on your own. If you can't and you have to go to therapy, that's okay. If you can't and you have to take medicine, that's okay. We would rather be a whole you, a complete you, and managing everything properly than you not telling anybody, not managing it. You get to a point where it's just too much and it's bottled up, and it leads to you hurting yourself, others, or worse than that. Next, I want to talk about, for me, racism, bias, inequality, all that in various nursing programs. I didn't really have that problem for LPN program. Like I said, I had the best experience, and I would do that many times over. So my LPN classmates, if y'all are watching this, I love you guys. I miss you guys. You guys gave me some of the best experiences and memories of my life in that cohort. And I am forever grateful for you guys. And I love it. And like I said, I wish everybody could experience the things that I experienced with you guys during that time. My RN program, I'm not going to say too much, but the racism was loud. It was very loud. And not only was it very loud, whenever somebody tried to speak up and say something about it, it became a whole thing. And for anybody that knows me before, I was just very shy and I just wanted to keep the peace. I didn't want to be going off or cussing nobody out. And I'm just like, you know what? I've been dealing with this for forever, so whatever. What's a few more people to the list of being racist? But it came to a point where I was just like, yeah, no, I cannot shut up no more. Like, y'all about to hear about it. And I guess for me, it's really hard to get people to understand that if they're not personally experiencing that for themselves, because you really can't explain that to somebody, because they're going to do, what anybody else would do. They'll try to comfort you and tell you that it's okay, or it's not that serious, or it's not like that, but they're not the ones on the receiving end. Sometimes I felt like in some of my programs that I was treated like I was less capable. And I'm going to be quite honest with you, as a woman of color, I always feel like I got to do a little bit more. I always feel like I got to do a little bit extra just to prove that I can do the bare minimum. And it's sad to say in today's society, and I'm sure other people feel that way too, but that's just always how it's been. to, meet those standards of some other groups of people. We just have to do a little bit more. But even still, when we do a little bit more, that might not be enough. And that's frustrating. That's a frustrating game to play. Always constantly feeling like you have to play catch up. And I feel like I did that a lot in school. And like I said, when I tried to advocate for myself, it was just blown out of proportion. So with me saying that it was blown out of proportion, I also felt like sometimes when I would try to vocalize or verbalize how I felt, people, especially like the dean, or maybe just people in admissions, would tell me that I'm being too sensitive about it. And it's like, no, I'm not, but I'm going to call out your bullcrap because it needs to be called out, right? If we keep just letting it happen and you think that it's okay, you're not going to think twice and you're going to continue to do it. So that's just me, I guess, putting my foot down and breaking the cycle. Professionalism as a means of a weapon. We are policing, the tone, hair, dialect, emotions of people. I know I'm not the only one that hated wearing them all white scrubs. If we dealing with pee, poo, blood, why would I want to be in white scrubs all day? They ain't going to be clean. And if they start out clean, they ain't going to stay clean. I can remember when I first got my scrubs, I'm like, why are they white? These ain't going to stay clean. I'm not going to keep these clean. I know I'm not. And I managed to keep them clean that first day. Washed them, laid them out for the next week of clinicals. 2 seconds in the shift, I done got a busted pen. Somebody decided they wanted to pee and get urine everywhere. And then we went to clean a blowout, and they just kept going. I just think that that's nasty, that's dingy, that's tacky. And then after a while, some of my classmates just stopped giving a damn and would come in there, scrubs all wrinkled, which I get that you have to hold us to a standard. But, like, y'all ain't ask us nothing. Y'all just doing what y'all want. Again, in today's time, 2025, I feel like more people are steering away from the white scrubs. Thank God. But telling us that we can't, do that, or we can't have certain hair colors. Nobody's going to care if your hair is purple, green, pink, orange when you get on the floor, as long as you know how to do your job. Now, I understand why we have to pull our hair back, things getting caught, patients pulling it. So that aspect I understood. But telling us that we have to stick to, natural hair colors and all. I just felt like some of the things that we could have been focusing on in nursing school turned from those things aren't important to, oh, well, let me nitpick on your uniform, what you're wearing. Are your socks long enough? Is a hair out of place? All those things. Emotions. Teaching us to separate our emotions from being a nurse. I know me personally, I am just very in tune with people, how they feel. I want to help. So that was a very hard thing for me to do. In RN school, I had an incident where we had 2 patients for the day. One of my patients ended up leaving. So I was able to just be a little bit more, involved with my other patient for the rest of the day. And she ended up talking to me. She's just like, I don't know what it is. Like, you just look sad. I was like, I'm not sad. I'm tired. And that made her bust out crying. And I was like, well, what's wrong? She was like, I'm here in the hospital. I'm sick and I want to die. And I'm sad because my son committed suicide a few days ago. And that's why I'm here. So just sitting, I was able to talk with her, hug her, and just be there for her. And my instructor going to have the nerve to tell me that's not my job? Like, girl, what? That's not my job? She was like, you didn't need to get emotional, because my eyes started to water. It's just like, I felt horrible. Like, I really, sympathize and empathize with her, just because life is hard and I can't even imagine, what she went through or how that felt. But it made me kind of get teary-eyed, because it's just like, I don't ever want anybody to feel that way. And like I said, if I can help, I want to try to help if I can. Y'all just made things unnecessarily hard, like hard for no reason, legit. And then diversity programs that are performative instead of protective. I tried to join as many committees as I could anytime I was in school, whether it was LPN, RN, all of that. Y'all want to know what the most diverse committee, club, department was at any of my schools? If you said the diversity department, then you're correct. The diversity department, that's it. I feel like we advertise these things to get people in and make them think that we're inclusive, when in reality we are not. We have certain standards we want to hold up for the school and the image, and we're not showing people what's going on behind closed doors, but who will, right? Because nobody's going to want to go there. But it was just a bunch of fake bull crap going on, and I'm just like, y'all ain't about to use me as no poster child. I know I'm big sexy and all, but plastering me on the front page or on a commercial to show me as a little token child, I'm just not for that. So some of the financial strains and exploitations in school, them fees, I kid y'all not. When I was in RN school, I used to get so pissed because I never looked at my fees really in LPN school. I just paid them, and I didn't even pay a lot because I was fortunate enough to get scholarships all throughout LPN school. RN school, they was charging us for some of the stuff we was not even using. So you know me, going through my receipts, seeing what I'm paying, and being like, I didn't use this. Can I get my money back? No, you cannot. Or in some instances, they are so strict on deadlines. Well, if you don't pay this by this time, we're going to drop you. And it's like, I got enough going on. Why are you adding to all of this? On top of that, y'all want us to go to clinical, which most of the time is 12 hours, unpaid. I used to hate going into clinical, and I keep saying the word hate. I really don't like to use that word. I used to really dislike going into clinical, and they're like, you got to get a report from your nurse. They would not want to give me report. They would give me half-ass report. They would be rude, snidey, short, and basically they did not want us there. But let somebody have a blowout and have poo up their back to the back of their head. You're quick to call us for stuff like that because you get that extra hands, those free labor, but you don't want to teach me the things I will actually be doing. And not to say we won't do that on the floor, we will, but like the critical components, passing meds, seeing the patient's labs, and like I said, putting all those things in order. You're not willing to take the time out to teach me those things. What am I here for other than to not get paid, be stressed because I'm not getting paid, and I can't work because I'm here? All the things. I used to be so jealous of my classmates that were like, oh, I don't gotta work. Must be nice. I literally, y'all, and this is my first time telling a broad audience this. I know a lot of people that were strippers in school or dancers, whatever you would like to call it, midnight ballerinas. I was legit contemplating. I'm like, baby, we got to make something shake, and it's going to be this. You know what I'm finna say. So I literally was like, oh, in RN school, I'm like, I don't know nobody out here in rural Arkansas. I can go do this. And nobody will ever know. I could put on a wig, it put me on some big lashes, come here a couple nights, make my dough, and leave. Y'all, I literally called them because I was like, I'm really about to go through with this. And they're like, yeah, you got to come audition. I was like, audition? I'm like, I don't just let anybody up in here. And they're like, no, ma'am, we do not. So I ended up having to get a second job. But yeah, those are the archived Logan Chronicles of all the things that I either did or thought about doing at my time during nursing school. And then another thing that I think causes a financial strain is how they are, setting up this criteria for people to receive scholarships or additional funding, making it hard. I forgot the website that they have for scholarships, but all the things you have to fill out and all the letters you have to type and all the things you have to submit, it's just like, baby, I'm on this site looking because I need the money. Why am I writing you a 24-page paper to get a scholarship? So stuff like that are our for-profits, and then our false fast track programs. When I started at Capella, I was like, oh, bet. flex path. I had been seeing people on, various groups like, I got this done in 6 weeks, da da da. Which people were getting it done exponentially fast. If you were committing, getting teachers that graded fast, and just pretty much doing, everything you needed to do to move along in the program. But there would come places or certain classes where you would get halted because it's advertising a fast track and you can do these things, but it's not telling you all the little roadblocks and things you're going to have to do to get to the next step to be able to complete it in a certain amount of time. So I was willing to do the work, but I was very frustrated for some of those programs because they advertise a fast track. Even when I contemplated going back for my DNP after I got my DHA, some of those fast track programs like, oh, well, if you do this, we're saying fast track, but that's if you have all these things in place. If you have your preceptor set up, if you have your money ready to pay, at the shortest 2 years, at the longest 5. So just false advertising like a mug. So what are some other issues I have with nursing school? I'm glad you asked. The disconnect between school and reality, and we kind of talked about this earlier. What I'm learning in school was nothing compared to when I got on the floor. And like I said, my lab values, basic stuff like that, I knew what it was. But in turn, did I really know what was going on, what that was affecting? Could I say, oh, my patient's potassium is irregular, so now they're having palpitations or whatever? I wasn't making those connections. And I feel like nursing school is teaching us to give what we would consider ideal care, how things would go in a perfect world if you had all the supplies you need, if you were fully staffed, if you have everything going the way it needs to go. And then the hospitals, when you get there, you are thrown to the jungle. I never cried so bad as I did in my first 6 months when I got on the floor out of RN school. And I say that just because I was just overwhelmed. It's easy to sit and learn stuff from a book or read it and know how to do it and check off, which I used to be about to poo myself because I was stressed for checkoffs. But it's easy to know those things and know how to do them. It's different when you get on the floor and actually have to implement it. We went through mock codes and stuff all the time in school. The first time I actually had to get on a patient and do chest compressions, totally different world, totally different from the book. And I just feel like that is one of the reasons now that we have so many new grads that are overwhelmed because they're not prepared. They, have this pretty picture in place and they think it's going to be one way when they get to the floor, and it's completely different from, what is going on in reality. And I can truly say that is one of the hugest contributors to the turnover. And what's so crazy is now we are pushing out more new grads than ever, but they're not staying. They're like, bump that. I got my nursing license. I could go anywhere. It's putting us in a position where we are having to pick, do we want to continue with safe practices or are we wanting to do real world shortcuts? And I can tell you, as somebody who works in a trauma 2 hospital, the shortcuts that I see, it's a lot. And not everybody's shortcutting, but a large majority of people are doing shortcuts. And it's just like, baby, we don't have what we need. We weren't prepared for this. That's probably one of the biggest stressors, I'll say, especially in my new job now as an educator, going for a nurse's 6-month rounds and they haven't even made it to 6 months and they've quit. Or people stopping me on the floor that's been on the floor and they're like, yeah, I can't do this anymore. It's too much. I'm about to quit. I hear that more often than not. And for me, I'm supposed to be kind of a bridge. So I obviously try to see where things are going wrong and discourage them for leaving. But honestly, some of the stuff is out of my hands and there ain't nothing I could do about it. So, academic bullying and power exploitations and struggles. A lot of times in nursing school, I would hear people try to tell others that, pretty much gaslight them saying that they're not dedicated enough if there was an issue or if they try to bring something to their attention, this maybe just isn't meant for you. I love going somewhere where somebody told me I couldn't do something just because it was hard, and I get to tell them I have a doctorate degree. My little dean, I ain't went down there because I like to make pop-up trips. My little dean of my RN program, they gave this woman this position and told her that within 6 months she had to get her bachelor's degree and they would pay for her to go. But that was one of the requirements listed on the job posting on the school website. Well, she said she was too old. She was not going back to school and they were just going to have to deal with it. So many times in my mind, I wanted to be like, girl, I want to go back and be like, remember the one that you told it wasn't dedicated enough because all this stuff was going on. She was driving all this way and she couldn't do X, Y, and Z. I have a doctorate now. I can come take your job, but I try to be humble and not do that to people. But I really be wanting to apply just so I could get it. Now clock that. But no, just knowing that that's not the case just because you're tired or you're bringing something up. Don't let nobody gaslight you. Leaders love to gaslight. A big portion of nursing leaders, whether it's in the hospital, nursing home, nursing school, gaslighting. They love to gaslight. And don't catch on and figure out that they're gaslighting you and tell them about it, because then it's going to become something else. Instructors weaponizing grades and making sure that they are using your recommendations as kind of a weapon against you if you're not making the grade, or trying to pitch you against your classmates. That is one thing I loved about my LPN class, y'all. We worked together all the time. And if somebody was having a problem or struggling, we were like one band, one sound. What you don't understand, how can we help you? We all knew a little bit about different things. So, I mean, it made the most sense to work together and get through it. We did lose a few people, but I don't think it was nearly as much as some of the other classes and cohorts around, just because we had that bond. So, lack of accountability or safe reporting for mistreatment. We report something, and where does it go? In a file, in a box, in a corner, dust on the box. Y'all aren't doing anything about it and wonder why we don't complain. Or wonder why we keep complaining, because y'all aren't doing anything about it and y'all are just okay with how things are running, or maybe feel like you can't afford to do anything about it because these are the only teachers we got, so you just have to deal with it. But what y'all gonna do? What y'all gonna do to change that narrative? I'm always gonna ask y'all that. I'll probably ask you that every episode. What y'all gonna do to change the narrative? Because the lack of safe reporting that we have for mistreatment and things of that nature, that's why y'all in the business y'all in now. I'm so happy more people started speaking up and suing and everything else and letting these nursing schools know we're not playing with them. When I had a problem in nursing school, a large bulk of my classmates, well, I say a large bulk, some of them were having the same issue, and we all rallied behind each other and reported it, and they tried to sweep it under the rug, and we just came right back behind them and like kept reporting. We're like, okay, you're going to keep playing with this? We're going to take this to the news outlets. We're going to take this to Facebook. We're going to take this to all these places. And they had finally put something in place and gave us a fair and just hearing after that, and allowed some of my classmates that had been suspended to come back into the program. And then they started treating us better, not the greatest, but better than they were before after this. So how can we redefine education? With educated versus indoctrinated, I want y'all to think of it from a standpoint of learning to conform versus learning to critically think. Some of these new grads, not critically thinking, and I done said this before, we are taught to just go about it the way it is and not question anything. And honestly, we learn to be good nurses in nursing school. And part of that is critically thinking outside the box, thinking of those solutions that can help and make things better. You shouldn't want to just ever go somewhere and do the job or not question anything because that's just how it's done. Because that's how we have problems and we hurt people. And with that, I say it time and time again, closed mouths don't get fed. I am a firm believer, be the change you want to see. You don't have to deal with that. We don't have to keep doing things the same way. We don't have to stay in the same hamster wheel, turning, going round and round and round and round and round, trying to figure out what can be done or if anything's ever going to change. Sometimes it takes that one time of you getting tired and being like, okay, we're all doing the same thing. We're all operating on the same length. Let's change it up. And I'm going to be the one to do that. And that's how it should always be. We need to learn what it looks like once we unlearn all the things we were taught in nursing school, because it was different. And when I say unlearn all the things, obviously knowing, your disease processes and the basics with that, your lab values, the different fluids, all that is very important. But knowing to be flexible and not keep that same conditioned mindset that we got in nursing school. Makes me think of like dog school. They're training you to be a good nurse. They give you a treat when you're done. And then you get out on the road and you're like, whoa, a whole new world of things. I get to play and explore and do all these things. It's just like you don't have to stay in that mindset and do that thing. Like I said, if in a perfect world everybody was that way, nothing would get done, no changes would be made, and it would just be the same old boring world, boring thing. So we as nurses need to know how to just reclaim our power and our voices and not just obey what the big dogs are saying. I have a good friend of mine coming on one of my mini series, and me and him, we always laugh because something happened and we got in trouble, and it just makes me always think about, wow, I used to be so just, like I said, quiet, going with the flow, not saying anything, and I've become defiant in a way because I can talk a big game about making changes and doing things. And it only takes one time. If people see that, now with this being said, y'all watching, I'm not telling y'all to go in an uproar and start a strike and start doing what you want to do. But like, if people see it's okay to not do that thing, we don't have to just sit and obey them. Like I said, just because that's what we're supposed to do. We as humans are made to do more, question things, and constantly innovate and recreate. So just learning to use our voice in that way and stand up for what's right, no matter what that looks like. So now we will go to our mental health moment. Before we kind of get into that, I just want to, like I said, just kind of step back and let you guys know, if you are in nursing school now or maybe thinking about going to nursing school, it is hard. Nursing school is hard. It's not easy, but it is truly one of the most rewarding things I personally feel like you can do in your life, and so many doors and opportunities will be opened up to you once you graduate. So don't just think you have to stick it out. If you feel like it's not for you, you've done everything, you've tried, you've redirected, go to something else, and that's okay. But if you know that it's for you and you want to do it and you need a little bit of extra help or assistance, please reach out to me, to your mentor, preceptor, whoever, so that we can help you get through, some of the very hardest times in your life. You're going to have late nights. You are going to be stressed. You are going to pull all-nighters and do all the things. I've never been one to do that. And I told my classmates all the time, if I don't know it by 10 o'clock, I just don't know it. I am not going to stress myself out trying to cram and do all those things. That's just not functional to me, and that's not how I operate. But find what works for you and do what you can to, get things done. So, something for y'all to think about as well. So, our theme for our mental health moment this week is going to be self-compassion. How do we let go of perfectionism in learning environments? That was very hard for me as a bright-eyed, bushy-tailed new grad nurse. I wanted to do everything right. I wanted to know everything. I wanted to get a skill right on the first time or know what particular medicine was for a disease process. And I really just had to tell myself that everyone is human. We are not machines, and even machines make mistakes. But nobody's expecting us to know everything. That's sometimes just a standard that we hold ourselves to a point where it can hinder us from learning. Because honestly, if you think you know everything, are you really going to want to learn or be open to learning? Probably not, because you already have it in your mind that you know. So don't think that you know everything, and be okay to learn. And even me with several years under my belt, and it's so crazy, I can finally call myself a nursing veteran. Even me with so many years under my belt, I'm still learning new stuff every day. And that will never change just because we are in an ever-changing field. So that's kind of how I let go of perfectionism. It's something that I have to just constantly tell myself it's okay to not know it. And even if you don't know it, doesn't mean you can't learn it. And even if you learn it, doesn't mean you're going to be the best at it. It's something that you can constantly craft and work on. But again, you're not going to be perfect at everything. Nobody's perfect and nothing is perfect. So just talking to yourself and looking at it from that standpoint. I'm going to try not to do so much divulging on the side in my next episode. I just feel like I haven't talked to you guys in forever. So I just want to tell y'all everything, and I want to talk about all the things. So on next week's episode, we will be getting into nursing school admission. It's kind of like a little ping off or branch off from this episode. And it's called GPA, not grit. So we will kind of dive into that and why, the grades is what matters, but the other things should matter too. So as always, it was a pleasure just getting back into the swing of things. I am working on doing better and being more active and posting episodes and having my stuff ready. So I will catch you guys next week. And until then, toodaloo. Bye, guys.